Another busy week in the chai office.
Like you say, I mean, the conversations that we have, if I think about it a few months ago, I felt like it was just us having all of these conversations. And now, like, with all the new clients coming in and all the new projects that we're open to and the events and the talks and everything that you're going to, it's like really exciting to see that, okay, we're not alone and thinking that we're crazy.
Still a little bit crazy,
Yeah,
but
but
absolutely not alone. But it's also interesting to see the spectrum of different views and approaches that people have within the space.
yeah.
And yeah, now definitely I find myself sitting in audiences being, oh, it should be like this. Or, oh, that's interesting. Oh, my goodness. Like yesterday, like you were saying, I went to an event yesterday, was the opening of a Center of Excellence for Women's Healthcare in the UAE. And there was actually a panel of doctors. They were all very holistic, functional medical, sit down, speak to the person, understand
Yeah.
that they end up doing actually extra hours within their surgery or their practice times because they're listening to their patients,
Yeah.
and seeing that it's more the approach that we would take. And then made me take a step back and be like, oh, maybe I was being too harsh. Sorry, healthcare.
But I think also in general, like if you look at traditional healthcare and the good and the bad and the ugly and the, middle ground of it all, like we're so used to a very specific type of language, a very specific type of branding. It's only in the last couple of years that there's been this boom of like, okay, wow, we're actually stepping away from the white, gray, and blue hospital branding, and you know what I mean. So I think it's also unlearning everything that we're used to, and that's why when brands come up and they are using this kind of emotive, as we call it, human language, it does make you step back a bit. You're like, oh wow, this is interesting, not just being like having like a whole bunch of technical terminology thrown at you. So I think it's really exciting.
I find it exciting as well because it's really that window, that opening to be able to invite people in to learn more about
Yeah.
themselves and about, because that's one of the biggest things yesterday as well when I was listening to that panel, and they were saying, oh, it all starts with education, and we all know that it's like the awareness and the personal journeys that we've had. And I know, speaking from my own experience, that I've spoken about it before, that the insurance industry, it was so difficult for me to get insurance because I was so confused of like, where do you even begin? I don't
Yeah.
understand this. But and people say, oh, you need to educate yourself. But how do you start educating yourself? Like, do you go to TikTok? Like, where do you find? And then they say, don't trust the stuff you see on social media.
Exactly.
So now having these professional brands that are research backed, actually having content that are very engaging, very simple to understand.
Yeah, and I think it's, like you say, also everyone gets educated differently, right? So whereas someone like, I know in my family, my brother, he's very kind of logical, factual, technical person. Like he wants to only read exactly, like doctors' articles, and he wants that technical language. That to him makes him feel safe and secure. My husband, who used to be a paramedic, same thing. Like he loves that technical language and he feels very educated and comfortable with that. Whereas me, I'm like, that just makes me feel completely overwhelmed. You're not connecting to the human in
Yes.
me, and you're not breaking it down to a point that I can feel comfortable. And I think where a lot of people, and I guess this is where this whole conversation started with us in general, is that a lot of people have just been taught that, okay, well, hospitals, doctor, the healthcare system, they all know what they're doing. They will tell you when you're sick, this is what you need to do. You don't ask questions and you just go. And actually, like, no, whether it's insurance, a doctor's consultation, this is about me and my health and my body. And I should be allowed to ask the questions and, ask you to rephrase it if I don't understand and get clarity, because this affects me and my one body that I have on this planet. And I think we're now getting to a space where people are starting to feel comfortable, asking questions. And you're right, so, never Google your symptoms because, geez, no matter what you Google, you have cancer and you're going to die. But I think now people, the good side of social media, people are having these conversations. They are being more open to it. I mean, listen, it still kind of leaves a little bit of room for the hypochondriacs there.
Sure.
But yeah, I think it's a really nice time to see that there is this like comfortable space that's up and coming for people to actually have more open conversations about their health.
But I think even from a business point of view, like you said at the beginning, that healthcare has always been that very cold, sterile
Yeah.
branding, and all the spaces when you go into hospitals, very clinical. Obviously, that's what where it comes from. There's a reason for it, but when you look at the hospitality industry in the UAE, for example, and all the experiences that we get brought, and they're so inviting, it's so exciting to go to, you want to try them out. And if that was healthcare, then that would be interesting because you'd be like, oh, let's go try out this. Or there's like different treatments that you can try out, like infrared saunas, or they're saying at the moment, or the IV drips at home, those kind of things. But then actually taking that to the next step and then being able to actually track your health. So it's not just a fun one-off and you don't really know if it's having an effect. Like everyone's taking supplements at the moment. How are they choosing those supplements? Do they know if it's actually working? So being able to take it to that next step where you're actually tracking that.
Exactly. And I think I know this is something that we've been talking about a lot as well, is the all these upcoming kind of wellness hotels and,
Islands.
Yeah, islands. And I mean, as only the UAE can,
yes.
make it so extra. But, a couple years ago, it was just massages, the hydrotherapy, infrared saunas, like you say. But now it's actually like very traceable, real data of things that can really affect your health and really, help you improve your vitality and your longevity. And I think people are starting to take those things more seriously because now we're starting to have conversations more about longevity. It's not just about your health and your kind of, the black and white side of things, but what can you do? And, preventative health is becoming way more of a conversation, which I know is something we speak about every single day.
I think it's a lot more accessible now, and especially with the developments in tech in the recent years, you can actually start visualizing those things. And now people have like Whoop and Strava, and there's those wearables, and they're used to tracking their data. So it's something, as you become more comfortable, more aware of something, more comfortable with something, then you're more open to it and more curious.
Yeah. And just to your point of it being more accessible, what I'm also liking to see is that first, let's say maybe over the last year or two, when these first kind of wellness hospitality venues were popping up, it was very high end, right? It was your kind of like your very high end, very high income individuals could only afford it.
So true.
And now it's becoming, in your word, a lot more accessible and a lot more kind of broad, and people are looking into it, and people are considering, is just going to gym enough? Is just eating healthy enough? Oh, well, now I actually have access to all of these things. I mean, you and I constantly talk about the app Valio here in the region, which I think is absolutely phenomenal. I mean, the way they started off just offering IV drips, and now the like huge variety of tests and scans and everything, and the way that they've made the information so open and so accessible, and you can actually, you don't just have to wait to get it approved by a doctor or a hospital or whatever. Like, you have access to so much more now. So I think platforms like that are really, really making it way more accessible for everyone.
And do you think that's something from like a branding point of view, or the way that they disseminate their information or make it accessible, that's led to their success, the speed of the success?
Yeah, for sure. I think, like I say, we are so used to this very technical language being thrown at us from, doctors about, biomes and I'm just trying to think of all the words that we were looking at yesterday in a client's presentation. But I think now when you do have brands like them who are kind of simplifying it, and like I said, you're making it more human, I think it's really amazing. And also giving an explanation on why these kinds of tests are so important. Now we're also seeing a massive uplift in talk around women's health and women's hormones, and why it's not just something to look at when you hit menopause. We've now... I mean, perimenopause is having a massive moment now. I know all of my friends are talking about it. It's something that, our moms never thought of or never discussed with us.
No.
And it's not...
Well, they were never allowed to discuss it
No,
themselves.
well, exactly. And it's not just a case of, oh, well, I should go do this hormone panel only because I'm feeling like this. Well, no, these are the kinds of things, because if you understand where you're at on these scales, these are the type of steps that you can take from a prevention perspective to help you as you enter perimenopause and menopause and everything. So it is definitely, from a branding and language perspective, just making it more of a comfortable space for everyone.
Yeah, and making it less taboo and removing the stigma from it, and it being like something you have to go and do quietly and hide your face and go to a clinic to go and talk about it, when it's something that happens to every single woman.
But, even if you think about things like, something like HPV, right? Human papillomavirus. Everyone sees it as like an STI, and it's a thing that like no one can speak about it. You kind of you would never ever want to hear those words because you're like, oh my God, this is it's actually such a normal thing.
Yeah.
And everyone like deals with it, and it's not, necessarily to do with you doing anything wrong. It's just like a natural thing. And I think like the more that people learn about it, and I mean, we can go down a whole rant about education in schools and how they have these conversations. And I think it's in most schools, traditional schools, especially the school that I grew up in, it's not done in a very holistic way. Like you're taught that certain things are like, you don't do this, you have this part, and like, khalas, we don't ask any questions.
I do feel sorry for schools though, with the amount of different cultures and
Yeah.
nationalities that they have, especially in this region, that you never want to offend it.
For sure.
Someone.
But even like, you need to also be so cautious of like what's happening in someone's home. Like, are their parents having these conversations? What conversations are they having? And it's something that keeps popping into the back of my mind as a parent. Like one day when my son is of age to have these conversations, like, do I need to check with his friends' moms and be like, hey guys, what conversations are we having? What are we calling everything? Just so
there's a line on this.
Yeah, just so that we can like all be comfortable. But
it's a good question. Like, is that something the school should be teaching kids, or is that something for the family
exactly
to be teaching?
But then again, it's like if there is a brand out there that's reaching kids, and again, I mean, this opens up a whole thing about social media and protecting kids from seeing things that they're not supposed to. But if you get a good, ethical, responsible brand who's giving kids or, young adults a very safe platform to read information, ask questions, things like that, I mean, that could be, a game changer, because I would far rather, as a parent, have my son be on something like that than
educational.
Yeah, than, learning from these things about TikTok and coming and asking me questions that I'm like, oh, okay, well, this is awkward. We weren't ready for this. So, but and I think this goes back to our general point of education in healthcare. And I think there are some brands who are doing an amazing, amazing job. Yesterday, we were looking at the NABTA website. Their messaging is outstanding, like absolutely amazing. I mean, scroll down to the second page. Their vision and mission is written out there in proper human language. I mean, I immediately, as I read it, I was like, that is amazing. Yes, like I want that. And I think what they offer is unbelievable.
You can see that as well in the clarity in which they're developing all of their new initiatives as well.
Yeah, for sure.
It's very clear vision and roadmap of where they're going.
Yeah. And I think it's, making sure that brands like that are heard and seen. And I mean, that's what we at Chai want to do, is we really want to put brands like that up on a pedestal and educate people that traditional healthcare, if you feel that it is not serving you, if you feel that you are not getting what you need from your GP, from your hospital, that's not the be all and end all. There are amazing clinics and clinicians and brands out there that are trying to do their best to help you and teach you, other ways and give you the answers to questions that you might have. And I think it's really important that we share these brands.
It's also been a shift. It's interesting, like with the traditional healthcare approach, because I know, especially in the UK, being British, that you used to be born in a town or in a village, and you didn't used to leave that village or town. So you would have your local general practitioner, your GP, who would know your entire family. He would know your family history.
Yeah.
He would know your father and your grandfather. And so there was that preventative care, that like ongoing care aspect to it. And it was only when we all started traveling and living in different countries and having medical records all over the place and didn't know our GP. And I know for me, every time I go to a doctor, it's a new doctor.
Yeah, exactly.
And so that's when you feel like, you don't know me.
But, that being said, funnily enough, I find it's quite a similar situation in South Africa, in that like you go to a doctor because your neighbor or whoever referred you. So you end up going to school, and it's like, oh, well, your whole friendship group, you all go to the same doctor, and you've all been going to that same doctor for years because that's just like the best one within your little clique. So
the insight that doctor must have.
Yeah, exactly. It's like, I know all of you.
Yeah. But when that's not there, then that's where the traditional healthcare, you feel rushed. And I think especially a lot of companies that are healthcare companies that have looked more at the profit and the bottom line,
for sure,
than they have at the level of care, and then they end up like double booking sessions or rushing people through. And we all know like the 5-7 minute consultations where you really don't feel that connection.
Yeah.
And that's But then healthcare as well, I feel, was always just meant, like insurance as well, was also just supposed to be for sick care.
Yeah,
You're supposed to be there in an emergency.
And again, I think it also leans into what we've been taught over years and years. I mean, if we look at, our parents' generation, is like you were taught that you go to college and you buy a house and you do this and you do that, and like health insurance, you have to get health insurance and this is how you do it, and you always go for like the most comprehensive one. And like, I mean, I've been living in this country for 5 years now, and the issues that I have had, even being on the best, most expensive, most premium health insurance, like for me, I always end up feeling like you're actually not listening to the human. It's just like, well, computer says no.
Yeah.
Okay, but like,
100%.
let's have a conversation. I mean, me personally, I have a heart condition. It's linked to a surgery that I had 33 years ago. I have, touch wood, not had any heart-related issues since then. And the minute any insurance company sees that I had this surgery in 1991,
Wow.
it's like the premium just triples. There's all these questions. I'm like, but you're not actually looking at the human. You're not asking me any other questions. You've got a stack of, like multiple choice questions in front of you, and you're just like, oh, well, that's how it's going to be.
In that instance, because I haven't experienced something like that, but in that instance, do they then refer you to a human doctor to speak to you about it and to do a physical?
They're just like, this is the premium.
Wow.
And it can, I mean, from first year to then the second year, in between I had my baby, and the second year my premium went up by like 150% due to age-related factors.
After 1 year.
I'm 34, and because of pregnancy and pre-existing conditions.
And overuse of the...
overuse of the policy. Well, I'm paying a fortune for this policy. Obviously, I'm going to use it. So why should I get penalized for things like that? And I mean, listen, let's not blanket it. We're not saying all insurance companies are evil, but it's just that case of taking that time to understand like the human behind the problem. And I always bang on about Discovery Medical Aid in South Africa.
Yes.
That's a whole other, we need to give them a shout out as well, because not only just from a medical aid and a medical insurance perspective, I mean, absolutely amazing. Their offering is brilliant, but their Vitality program and how they have firstly gamified their offering, but how they've looked at the human, at individuals and what actually drives these humans and what is important to them and their longevity, and the way they've made that work for them is absolutely incredible. I mean, things like your healthy shopping bonuses. So if you go do your groceries, you're buying a lot of veggies, a lot of fruit, a lot of healthy foods, you scan your grocery slip into the app and you'll get monetary discounts for consistently eating healthy. You buy your...
Do you get fines for cookies?
I believe
for that night on the town?
I think you actually get not fines, but they also have a link to your car insurance. So they have like a little tracker that you put in your car, and if you get caught like constantly kind of hard braking, then they're like, oh, that car insurance premium is going to go up because you're clearly not driving very safely.
Well, I had to get the brakes changed on my car yesterday. Hopefully.
But even purchasing your wearables, your Apple Watch and everything through them, and then hitting your points, doing all of that, and you get, I mean, you can buy, I bought plane tickets before with my discounts and everything from them. But what I really praise them the most for is, for instance, they've got all of these generic, like kind of widespread benefits and everything, but then dependent on your own individual fitness and health tests that you can voluntarily do each year. And, if you improve on your own personal fitness test, so, they'll put you on a treadmill with a bunch of monitors, you can do blood tests, eye tests, all of these. And based on your own personal improvement of these tests, you obviously get benefits and discounts on premiums and things like that. But they've just, for me, I feel like they really care about the human being behind the policy. And I feel like it's so rare.
I'm really excited for the next episode we're going to go and unpack all of the language and the ways that they make that accessible. Because again, I think even now with a lot of the services that we have, there are actually a lot of these things available, but just no one knows about it. No one knows where to begin. So I'm looking forward to the next episode. We'll be unpacking that.